Hi, this is Dr. Jim Anderson from Anderson Podiatry Center. And as you can see, I'm standing outside of our operating room here. And I'm going to talk to you today about bunion and bunion surgery specifically. And you may not be aware, but we're kind of unique in that as a podiatry clinic, we have our own surgical center. It's great because we have our own staff. They're well trained in what we do, and kind of spoils us, frankly. But let me talk to you a little bit about bunion surgery. And I'm going to try to keep this very simple. And really what I want to talk about was, when do you have bunion surgery? I mean, that's a very interesting topic to talk about, because I think there's lots of questions as to when you should do it. And I think it's a really important thing that you should discuss with your doctor. And it's something that has to be mutually decided upon between you and the surgeon that you're seeing. So first of all, let me define a bunion really quickly and just give you a few concepts. Basically, a lot of you probably are aware, but if this is a skeleton of the foot, what happens with the bunion is pretty much this first metatarsal bone here. Here's the second metatarsal, here's your big toe. But this bone is no longer parallel to the rest of the long metatarsal bones. And this first metatarsal tends to want to come out and to the side, and then the big toe starts to go this way towards the second toe. So you end up with a big bump. The problem, though, isn't the extra amount of bone there. There can be some. But a lot of it's not the bump, but actually the angulation change between this bone and this bone. And so, depending on the severity, sometimes we shave off the bump here and then we slide this portion of the bone inward, or more severe cases, you may have to come back towards this part of the bone and make a bone cut back here to shift everything over. So probably 90% of the time we're using bone cuts up here. And it's nice because usually within about 3 weeks, maybe 4, you're back into regular shoes. Not dress shoes, but like tennis shoes. And for about 2 weeks, you got to keep it dry, 2 to 3 weeks. But that's just some basic things. It's really rare that you would ever have to be off weight bearing for like 4 to 6 weeks. That's for more very severe bunion deformities. But so when does one do this? Well, what I always tell patients is, you don't want to do this for cosmetic reasons. There may be a patient that I have, with really bad bunions, but if they wear Birkenstocks or lace-up shoes and it doesn't bother them well, I just don't think they should have the bunions corrected. What I like to tell patients is, it's so dependent on the shoe gear that you wear. And obviously, more women are going to have this done than men, kind of because of the demands of shoes. And so I don't think one has to wait till you're necessarily uncomfortable in dress shoes and tennis shoes to do surgery. If you, especially as a woman, think it's important to be in dress shoes, maybe it's your profession or you just like that, and if they're fairly reasonable shoes, not like 3-inch heels, then maybe that's a time to do surgery. So if I have somebody coming in and, hey, dress shoes, and it's a lady and they're not a big thing to wear dress shoes, I don't need them, well then don't bother with surgery. Just wear more practical shoes and the bunions probably aren't going to hurt. But if you, as a lady, think it's important and it's just part of who you are, you like shoes, and they're fashionable, but they're reasonably fashionable, I think that's something that you may want to consider. We don't necessarily wait till you're painful in dress shoes and lace-ups to do surgery, if that makes sense. So it's something that has to really mutually be decided between you and the doctor. Again, you just don't want to do it for cosmetic reasons, but yet I think it is a bit of a layup, but yet I think the results can be very good in most cases, so that you're very happy with the outcome and you can wear shoes more comfortably. As I always say, it's not your shoe that's the problem, it's the foot in many cases. So I hope that helps you a little bit. It's a kind of a mutual decision, because in my realm, in podiatry, there isn't a lot more that we do. Sometimes we'll have people use orthotics, custom inserts. If you catch a bunion deformity fairly early, it might slow down the progression a little bit and it might help your discomfort. So there's lots of other things out there like splinting and all kinds of things that you can look at on the internet. But the only thing really that we tend to do a lot of is surgery and sometimes orthotics. And any of the other things, you're kind of free to try those on your own. And that's not what we're here to talk about in this video. So if you like this content, I would ask that you leave some comments, whatever you'd like to hear more of. We'd be open to that. And please click on the subscribe button. And thank you for watching.